video we'll be talking about the relations of parotid gland. So the parotid gland has an anteromedial surface. So this here will be anteromedial surface. It has a posteromedial surface. So this here will be the posteromedial surface, and it has a superficial surface that you are seeing through. So it has an anteromedial surface, a posteromedial surface, and a superficial surface. So the anteromedial surface, as you can see, is related to this muscle over here, which is masseter, and it is also related to ramus of the mandible. Now the posterior medial surface is related to sternocleidomastoid muscle, and it is also related to this muscle over here, which is the posterior belly of digastric. So this here is the posterior belly of digastric, and besides sternocleidomastoid and posterior belly of digastric, it is also related to internal jugular vein, which will be visible when I turn this model to other side. So this here is the internal jugular vein. So the internal jugular vein uh, descends into the neck through internal jugular foramen, through the jugular foramen, and cranial nerves 9, 10, 11, and 12 also pass through jugular foramen. So you can imagine that if it is related to the jugular vein, internal jugular vein, then it must also be related to cranial nerves 9, 10, 11, and 12. And I can show these structures partly over here. So this is the spinal accessory nerve or cranial nerve 11. This here is the glossopharyngeal nerve, and this here is the vagus nerve, that is the cranial nerve 10. And we are not able to see the cranial nerve 12 here, but it is also related to that. And now we will see the contents of parotid gland. So I have faded the color of the parotid, so we can see the structures which are passing behind the parotid. So this here is the cranial nerve 7, which is fanning out to give out the 5 branches like this, and this, and the other branches as well. So one of its contents is cranial nerve 7. The other content is the external carotid artery, and the other content is the retromandibular vein.